Welcome to the Resilient Butterfly Podcast. My goal is to share inspiring stories of healing and recovery through many diverse approaches and models. Our guests bring incredible lived experiences, insights, and or professional expertise, each with their own unique path. While we highlight and celebrate these stories, our intention is to inform, inspire, and demonstrate resilience and creativity. This podcast does not endorse any one approach. We believe there is more than one way to heal, and we're here to showcase the resilience and possibilities that exist. Welcome to Resilient Butterfly. I am so excited for my guest today, who is an executive director at Milestones Ranch in Malibu. And most of you, well, some of you may know her because she is a rock star. Denise Klein, who is the CEO and co-owner of the Milestones Ranch, which is a substance abuse mental health facility. Actually, it's a ranch. So I won't even say facility because it is gorgeous in Malibu. And yes, it is safe from the fires. So they are a leading dual diagnosis treatment that has been awarded the inaugural Small Business Award by Los Angeles County Supervisor Lindsay Horvath. Did I pronounce that right?
Correct.
And Denise earned a social work degree in 1992 and has been dedicated to the field of social work for all these remarkable years. And she has an unwavering belief in the potential for growth, change within individuals and family systems, along with a commitment to solution-focused and strength-based approaches. She really drives the work at Milestones. In addition to the work at Milestones Ranch, Denise is collaborating with Dr. Seth Kadish and Kurt Garby on a significant book, The Truth About Rehab, which is scheduled for release sometime in 2025 and aims to bring compassion back into healthcare and reduce family suffering by emphasizing the importance of relational rather than transactional approaches to healthcare for meaningful and lasting transformation. I'm so excited to be talking about all of this. Today, I would like to discuss why Denise's passion, why she went into the field of mental health and substance use disorder, and the repair of relationships that she has seen in recovery with families, and why is it important for families to have their own recovery and successful healing, and what does that look like? So there are many things, Denise, but as a true friend of mine, a colleague, I applaud you for all the work that you have continued to do. We've had many clients at Milestones, and they and their families are just so grateful for what transformation has occurred for them. So let's start with why. Why have you done this work?
Well, first of all, just thank you for allowing me to be here today. I love you dearly.
Yeah.
I love the work you do. I love your team. You have the most extraordinary professionals. And I think, from the beginning, it was clear that your team resonated with conscientious nature of the work we do, because it's very serious work and it's very important work.
Yes, thank you. I appreciate that. And we have a mutual love for each other, your organization and our organization, and constantly and continually being there for the clients and their families and the struggles that you've seen as they come in and the blossoming that they have had really going out.
Oh, 100%. It really has to be an avocation, a calling, because there are easier ways to make a living, right?
For sure.
It's this kind of work, especially the way we do it, the way you do it, the way we do it at Milestones it's around the clock. It's like ICU. People are coming in. It's not their first rodeo. They've usually been suffering for decades. And when they arrive with you or with us, they need safety and they need that attunement that our teams can give. And so the reason I went into the field is actually I started out in journalism and broadcasting before
That's
I
right.
moved into social work. And I was a single parent, and my daughter's father is an alcoholic. He's sober now. He got
Hmm.
sober about 5 years ago. Took a few decades, but he's sober, thankfully. And so when I went into journalism, I realized that, you know, just like we're learning and have learned over the last decade that, a lot of the stories are embellished and sensationalized, and that
Sure.
wasn't for me. So I took a social work class, and I fell in love with the curriculum. And my first internship was doing intensive in-home therapy, where
Mm.
I was so lucky. I got to work with 4 families per year intensively.
Seriously?
Yes.
Only 4 families per year? Wow.
Yes, we would work with them. We'd go into their homes. We'd bring teams into their homes. So either they were, the kids were leaving foster care or some level of institution, and we were
Hmm.
helping them reunite with their families,
Um,
or we were preventing kids from going out of the home so that they never had to go to rehab or wilderness programs. And so I really had the luxury of being able to get to know the families intimately in their home. And it was, I mean, I couldn't even believe I got paid for it because I loved it so much.
that is incredible, incredible work that, being in their own environment, seeing the things that trigger them, the things that they display relationally with each other, to be able to work in their own environment is very, very cool. So now you've been at Milestones as a co-owner and the executor of for how many years now? You said
I'm going on 23 years.
23 years.
Been in
So
the field 35 years, but
yeah.
Milestones Ranch Malibu, 23 years.
And you are considered one of the premier persons in the field, as well as a premier person in collaboration. And that is not something to take lightly in this field because, and I want to cry, I'm
Hmm.
getting emotional already. You are one of the most special people that I've known.
Oh my
And
God.
being able to bring that into healing, into milestones,
Mm. Oh.
is really very special. And I'll pull it together here.
Oh. Oh, wow.
So, with that said, as clients come in, and families may be there with them when they come in, they may not, depending on if they're bringing them, because sometimes families don't really, it's not their best to come
Mhm.
in with them when they come into the ranch. From that place, how do you start working with individuals and then bringing the families in?
Well, to back up a little bit, I think, the way one stays um, in attunement with the level of work that we all do is to always remember that it could be your brother, your sister, your loved one in this space, in this
Hmm.
residential setting,
Hmm.
in your care. And so that's one thing we always remind the staff of at Milestones is this just isn't, another patient. In fact, in nursing homes, sometimes what they will do is to remind the nurses that this isn't just another elderly person
Sure.
coming into treatment. They have their pictures of their youth when they're in their youth on the wall. And so I think that's the biggest thing that makes the work so special is just really keeping your bandwidth um, at the right size. I
Hmm.
I feel for the people who go into facilities who have big hearts and then they're given caseloads that are unmanageable.
Sure.
And I think that has really impacted our healthcare system. So when people arrive at Milestones, um, the first thing we do is we do a full biopsychosocial assessment, which is about 12 pages.
Hmm.
We disseminate that to the team, the multidisciplinary team of the psychiatrist, the internist, the primary therapist, and 2 to 3 adjunctive therapists. And everybody reads the same information. And then we put the team together. And then we have a case manager who's always watching over the case to make sure if we need to do any pivots. Maybe something was missed. Maybe something needs to be readjusted. And we make those changes immediately because
Hmm.
this is healthcare and we truly are in the business of saving lives, because it
Sure.
is life and death when they come into a rehab setting. They're not coming to Milestones because there's just been a couple of hiccups.
Sure. There's
They're
as you
hurting.
said, multiple treatments probably beforehand and
Yes,
very,
many
very sick.
times. Exactly. And so we get to do that level of work. So I always say, I think that's the part too. If your caseload is too big, or they're not getting enough treatment or enough time to read the charts, the
Hmm.
MMPI, the neuropsych eval, you're going to miss something. And if you
Hmm.
miss something, you're not going to be as effective. It's like you have to look at it like you're going into a hospital and you're doing x-rays.
Right.
If the doctor doesn't look at the x-rays and re-examine them, you're going to miss something.
Right. Right. Exactly. And when do you start including families in, or how do you like really bring families into doing their own work?
Well, as long as we have a release of information, which we always want,
Hmm.
um, is right away. So we'll send out a questionnaire to the families, and then we gather all of their information. Could be a parent, it could be a sibling, it could be obviously a spouse, and
Hmm.
we get all their what's called collateral information, and then that's disseminated to the team so that we have the full picture of what's going on in the family system.
Sure. And how, given that you're in a location that's not in their environment,
Hmm.
how do you piece apart their environment and trying to figure out what their environment may be that they have been living in for that has, and some of the traumas or triggers or things that have brought them to the place where they're using substances or have severe depression or other mental health problems.
Well, that was the advantage of my early training in intensive in home, because you were right there
Right.
and you could see what kind of environment they were living in. If something was like OCD organized, too organized,
Hmm.
that can be an issue, right? Too
Hmm.
much perfectionism or complete chaos, different people moving in and out of the house every week. I mean, these were the kinds of things that I got to see in my early career. So when people fly in, say from New York or Florida, you're not going to get that same lens. But
Hmm.
that's why we ask a lot of probing questions and stay very curious about any collateral information is super helpful, and that's time consuming. And so our therapists generally carry a caseload of 3.
That's incredible. Three for them for the entire week. And do you have a family therapist then that works directly with the family?
Yeah, yes. Each family gets a family therapist, and then we look at the clinical underpinnings. Sometimes you need to start the family systemic work right away. Other times it needs to wait based on maybe there is some level of boundaries where it's enmeshed and you
Hmm.
need a little separation. You need some work on boundaries, healthy communication, fair fighting skills, and then when the clinician feels they're ready for the work, then we can either, if they're living in Florida and they're not able to get on site right away, then we'll start Zoom sessions right away.
Got it.
But we love the family systemic piece of what we get to do.
So
It
you
really makes
said
all the
you
difference.
said systems and systemic work. Can
Mhm.
you explain that to the listeners? What do you mean by that?
Yeah, family systems is like a mobile, and you put it in front of a window and you open the window. And, especially in a day like today where it's very windy in Florida, you're going to see a lot of movement in the family system, a lot of noise, right?
Hmm.
And when it's calm, it's peaceful, and the mobile is just, it's just there and it's pleasant. And so our job is to go into chaotic family systems. Usually it's chaotic. Sometimes it's not. Sometimes they're removed and they're not speaking. And
Hmm.
so our job is to assess for that and make sure that we're finding out what the underlying issues are for each family member. And interestingly enough, usually within 2 or 3 sessions, like honestly, I've been a family therapist for 35 years. I would say within 2 or 3 sessions, you see real movement in a positive way. People are really scared of family therapy. It's
Hmm.
scary
Hmm.
because a lot of times there have been resentments that have built up over the years and you haven't let them out. And so to think about going into a session and
And blowing the gasket,
Yeah, exactly.
like
Losing it.
having that pressure cooker, that like that low thing, and then all of a sudden having to let it go.
Exactly.
So in doing this, there was something I was thinking about as you were talking that it's going to come to me. It not only resentment, but or really shame and things, families that are shameful for whatever they're
Hmm.
experiencing, have experienced in their lives, and as well as the family system being secretive.
Exactly.
Can you talk a little bit about that?
Those are definitely issues that come up all the time. You can never fully understand. You could have, like in my family, there were 6 of us, and all of us kids, and
Hmm.
all of us have different interpretations of our childhood.
Yes, I had five, and
So,
yes, I can totally
so
attest to that.
yeah, and so you never know how a child is going to interpret a situation
Mhm.
or what kind of stressors are going on for the family. I was the fifth out of six. There was a 5-year age gap between myself and my sister that's older than me. 3 boys, 3 girls, and we all have different lens,
Mhm.
um, and the messages that we get stick differently. Some were like Teflon; it didn't stick at all. It's
Mhm.
like
Mhm.
this was a great. I didn't have the same experience you did with mom and dad, and you might have another sibling who's like, "Oh no, it was terrible,"
Yeah.
and I was tortured and I was neglected, and so I think that's the thing is really being patient as a family therapist, listening to the story,
Mhm.
and also creating a new story, not
Mhm.
living in that old story.
Yeah.
Like you have to go through it, but you also have to create a new story. And the question that we start most of our family therapy sessions out with is the miracle, because we want them to want more
Right.
family therapy.
Right.
So we say, if a miracle happened and your family system was different, or at this age when you experienced this, what did you need from mom
Mhm.
that you didn't get?
Mhm.
And they're able to say that out loud. And even if their parents don't agree, just having a bystander there to witness
Mhm.
that,
Mhm.
and maybe to say, "Oh yeah, I guess your mom still really doesn't get it or understand it."
Sure.
That is healing and that is alchemy.
Sure. And when families, when someone wants to create or you're trying to recreate a story,
Mhm.
looking at the person's perspective that you have resentments towards, if
Mhm.
maybe your parents or your sibling, and looking at their childhood, their own life. I know it's helped me put into perspective my parents
Mhm.
and some of the things that I thought shouldn't, whatever, happen. That looking at them as, okay, my dad's life was this. And I
Mhm.
know I imagine he never talked about it, but I imagine what his life could have been that shut him down for many years in regard to being able to say, I love you, even,
Mhm.
and having a perspective of why that person really, that's part of changing the story, right?
Oh, 100% developing that empathy for for your parents, for your spouse, for your child, and what they went through. Um, that's the most healing and most fun part of what we do is developing that empathy, because once you start to bring empathy into the equation, and that takes a while, and you don't want, you know, you really want to give people their space to be able to feel what they feel and tell
Mm-hmm.
their story. But now let's move into trying to develop empathy, and I think really skilled therapists can do that.
Mm-hmm.
It's an art.
Sure. Absolutely. Because many people hold on to their story because they
Mhm.
feel like they need to do that in order to survive.
Right.
It's a survival technique.
Yeah, the ego can be a slippery slope into hanging on to resentments. So then that's the work too is, okay, we're doing this work, and if you feel like the ego is driving the bus, so to speak, and they don't want to let go of the old story, then that's the work you do in individuals therapy as well,
Sure.
and through fellowship. And if you're open to 12-step programs, they're very helpful as well, is taking back your power of perception and changing that lens a little bit,
Sure.
because in the end, it really only it hurts you, and if you're hurting, then you're probably going to self-medicate in some way.
Right. Right. And only to break through all of that in order to find a better way to be able to manage and to do self-care.
Yes,
Self-care rather than self-medicate, right?
exactly. I had a mentor from the Betty Ford Center. He was a doctor who worked there, and when he was doing supervision, he would always say, "There's always a trap door for addiction. There's a feeling that you want to hang on to, and that's the slippery slope, and that's why addiction is so hard to treat. Is because if it were that easy to get sober, everybody'd be getting sober." And so why is it that there's that one or two behaviors or thoughts that are keeping you stuck in a victim mode?
So getting them out of that victim mode and getting them into a different way of life for them to be connected to people in a loving way, so that they don't feel like they're victimized themselves.
Right.
It's very tough to feel like you're a victim to life situations, because it puts up a barrier of that armor, like Brene Brown calls it, the armor that's around you that will prevent that relationship from growing. So do you actually have workshops where families come in, and like a 3-day workshop or 4-day workshop to work with families?
At Milestones, we do it all privately. So we do it every week with the families. They get coaching calls or they get Zoom sessions, but we don't bring everyone in together.
Got it.
And then we refer the family members out to Al-Anon and to therapy and to workshops like On-Site and Betty Ford Center for additional big group programming, which could be as many as, it used to be 40 to 50 families would be together. So you get that experience.
Wow.
I don't know if they're doing that as much anymore, but when they were in their heyday, oh my goodness, like they did such great work, because there is something really powerful about getting in the room, and then you realize
You're not alone.
It's normalized. This is happening to them, and so that's really important. But the work that we do at Milestones is private.
Got it.
Yeah, very private sessions.
Is there anything in California, or you send them somewhere else to, like, as you said, on site?
Yeah, unfortunately, we just have, we have the Bridge in Kentucky, and then we have On-Site, and then the Betty Ford Center. And I've been in the drug and alcohol industry for 23 years, and we wish there was something. You should start something in California.
It's just so incredible, because the family is the glue of connection of somebody for healing, that if the families can heal, then there's so much more success. I mean, it's a known factor.
100%. Connection, that saying, connection is God's protection.
Sure.
1,000%. There's nothing, and I know you know this, there's nothing more rewarding than working with a family and seeing them come out with big smiles on their face. And
relief.
A week before, it's like, I'm not doing that work. No way. I mean, we're all like that, right?
Well, it's to a point where they literally, some people really feel like they're going to die if they go through the work of unraveling or peeling the onion away from everything that's piled up in a family system. And it's years, and not even only that family system, but generations, right?
Right.
You want to talk about that a little bit, and the generational trauma that occurs?
Like passing on the recipe, exactly. And definitely the body knows the score. And so we definitely do a lot of lectures on basically the biology of belief and the genetic predisposition that one can have, especially when there's a history of trauma in the family. And again, that's done individually in the sessions, so that people feel safe, because it can be overwhelming to be in a group and talk about that sort of thing. So we're very careful about that.
So let's move on to your book, because you
Yes,
want to
that's
talk
exciting.
about compassionate care.
Mhm.
So what came about to even begin writing this book with Kurt and Dr. Kadish?
Well, they say there's two things that motivate a person, either piss or bliss. And for me, it was actually a little bit of both, because there's so much bliss from getting to do this work in this intimate setting on this beautiful ranch. You know, I hit the lottery.
Yes, you did.
I get to and the way I get to do the work, but I was intentional about it. I like when I took the job as executive director, it's like, if you want to fill this whole ranch up, because there's lots of houses on the ranch with beds, I am not the person that, that's up to you all to make that decision. But if I'm going to run the place, I'm going to do a stand and deliver model. There was a television show called Stand and Deliver. It was a movie. Jaime Escalante goes into the inner city, raises the children's SAT scores. There's only 12 students. And why is that? Because attunement, connection, the kids were seen and they did so well. And that was the only model that I was willing to do. So had I not done it,
This is a movie, Stand and Deliver?
Stand
I'm
and
gonna have to look
Deliver.
that
Yeah,
up.
it's a classic. It's yeah, probably about 35 years old. But it's something everybody should watch. And I think that if society kind of predicated itself on Stand and Deliver, and everybody, just really managed their bandwidth better,
Sure.
I think that we would have better healthcare outcomes. So the piss about the book was basically that I felt America had been branded with a false truth, meaning there is no cure. It was on TV. There's a cure. There's a cure. We wish there was a cure for addiction, but there isn't. And so families were just so darn confused. I've taken crisis calls for 35 years. Some people just they're like, you must make my loved one stay for a year in treatment. And then you get on the next call, it's like, well, 28 days is enough, right? And I saw that movie with Sandra Bullock, right? You go in and you get acupuncture and you swim and you get therapy and you're by the ocean and everything gets better, right?
A wellness retreat, right?
Exactly. So I just felt like it was super unfair
Sure.
to people. And it was confusing. And it was confusing actually in the industry too, because I think even sometimes practitioners kind of have different belief systems. And we all know that no matter what, it's one day at a time. There's triggers everywhere. So
Sure.
if you're coming in for substance abuse, if you get the job, it's a trigger. If you don't get the job, it's a trigger. If it's raining out, you want a margarita. If it's cold out, you want,
Well, I was just talking to a couple of the people that have been on the podcast about St. Patty's Day and Patrick's Day, and why is it that you drink so much on St. Patrick's Day? It's because it's a reason. It's not anything other than a tradition and a reason to drink.
a
So-
ritual.
Yeah.
And so the book, it was like, well, we've got to clear this up for families. I've got a family. I would want them to know this. I went through it myself with my daughter's husband, my daughter's father, excuse me. And my mom had severe depression. I just always keep that in mind. And so it's like there has to be a book that talks about the truth about rehab. And nobody wants to hear it's one day at a time. That's not, you mean the rest of my life? You get a 22-year-old in treatment who's on fentanyl. You mean I can never smoke a joint again? I can never have a drink?
Right.
And that's really
It's a hard pill to take.
hard for them
It's
to
like-
understand that. So
Yeah.
the book is
They want to take a pill.
exactly, and they want a quick fix. And America is addicted to a quick fix. They don't want to problem solve. And so once you start using drugs and alcohol, bottom line is your life skills decrease.
Sure.
And you don't continue to grow. Intellectually, you do, but emotionally, you're usually pretty stunted if you've been using every day, because that's your go-to mechanism. So the book is basically about how to pick a good rehab, um, and why is it so costly? Why is healthcare so costly? Should you pick a rehab close to home? Should you leave your state and go somewhere else? I mean, just
And
all
pick
the nuts and
pick a
bolts.
rehab that the insurance company pays for. Can you
Right.
talk a little bit about that versus a privately paid treatment program and what the
Yeah.
difference is between those two?
Happily, and just going back to when I started, first of all, to give a little context to that question is when I came out to California from Colorado in 2003, you could almost not go wrong with getting a good rehab, whether it was a hospital based rehab, in network, out of network, private. There
Hmm.
were so many good ones. And I was so blessed I got to tour so many of them. And that lasted for maybe 12 years or so. And then slowly but surely, private equity and
Hmm.
corporations started buying up all the rehabs. And so now we're at a place where most of them are run by corporations, and you just aren't going to get the same level of care. They're
Is
huge.
the
Yeah,
bottom line is the money
right.
versus the care.
Right. And so that's kind of where we're at now. So I've had different experiences with insurance, based programs.
Hmm.
Some of them are excellent and have top-notch staff, and then some of them not so much.
Hmm.
And so I always encourage people to talk to, especially in smaller communities, talk to social workers, talk to doctors, talk to pastors, talk to case management teams, and just ask them who is the best in the community, who has the best results. And in the book, we say, if you go to rehab and they won't let you talk to as many alumni as you want to.
Hmm.
Everybody can pull up one or two, right? But as many alumni as you want to, there's a problem there.
Yeah, sure.
And so you just have to really vet and ask 5 people the same question. And you're usually going to hear the same name from all 5 of them. You'll get other names, but you'll
Hmm.
usually
Hmm.
hear the same name. Even in LA, where we have thousands of rehabs, you're probably going to hear the same names.
So, speaking of LA and the fires that occurred,
Yeah.
have you seen an increased need for mental health services in the area because of the trauma that people have gone through?
100%. We've seen an uptick of about, I would say, 35 to 40% in our calls.
No.
I'm on the board of directors for the Palisades and Malibu Chamber of Commerce.
Hmm.
So we started a wellness series for all the victims of the fires. It's, it's not just the fires, it's now the road closures
It's
and
continuation.
businesses
Right.
that were not affected initially are being affected because they can't get business. So there's
Hmm.
an uptick in depression, anxiety, sleep hygiene issues, addiction, you name it. It's heartbreaking, and it's going to go on for years. And then the political cycle doesn't help it either.
Sure. Well, I don't want to go into
Yeah,
politics right now, but I understand
yeah, yeah.
completely.
It's a kind of a
It's,
trifecta.
yeah, it's really sad. I feel for everyone that has gone and through the fires, and it's ongoing. I went through a major flood when I
Hmm.
was in high school,
Hmm.
and the damage in the community and the depression and medical complications. My uncle had a heart attack shortly after because of the stress.
Hmm.
So I can only imagine what's going on there.
Yes, we're doing everything we can to help. There are so many therapists who've come forward in Los Angeles, thousands who volunteered their time for free.
Mm.
We have programs like Startup, and there's a place called the Ravi Lounge. It's not a lounge in the sense of a bar. It's a lounge
Hmm.
well-being center in Malibu. They're offering pro bono services for
Oh,
kids
wow.
and families. It's
Hmm.
just beautiful. So that part of it has in some ways brought our community closer together.
Hmm. It does bring it closer together, but there's so much trauma there that, sorted out, like 911,
Oh, 100%. And we can't forget about, like, you've been through it. I've been through it. I lost my home in a flood too in North Dakota. It's like, it's, again, going back to the news cycle, you see it, and we saw it on the news for a month, but the grief and
hmm
loss is really just kicking in right now.
Sure, sure. So, in our final words to the audience, to
Mhm.
everyone that's listening here, what can you say about where, what can you say to provide some hope for families that will be able to give them some understanding of what they can do for their loved one to get help?
Oh, that's a great question. And I'd love to answer that. First of all, you going back to the book, you have to look at what's called stages of change.
Mm,
So some people are coming into treatment motivated because they want to be there. They want to get better, and that's called an action stage of change. And then there's other people who come in through interventions, which we believe in interventions. We love
mhm,
interventions. And they come in and it might not be their idea to be there. And so
mhm,
they're usually in what's called pre-contemplation or contemplative about
mhm.
their issues. And so, with that being said, it's very important to educate yourself on those stages of change, because when people come in, it's the therapist's job to inspire them to want to get better and do the family work. And through the family work and through a holistic measures, most people do get better.
Mhm.
And the hopeful message is most people do get better. And we have tons and tons and tons of testimonials. The person who struggles is the person who doesn't follow aftercare directives.
Sure.
So they may come into treatment, even through an intervention, and say, "This is not what I thought. This was a great experience. I love it."
Mhm.
And no, I don't want to go to sober living afterwards. Or no, I don't want to do outpatient therapy afterwards because I got this. And so
Mm.
that's the slippery slope of
Yeah.
addiction, is to crawl into that space to inspire them to go back to one day at a time and to get the support they need when they leave.
Mhm.
And we have a tune up at Milestones, free of charge for 1 week. So when we get that patient who
Mhm.
comes in and say they do 30, 60, or 90 days, but they say they aren't going to do their aftercare, and
Mhm.
for some reason we're not able to convince them, then they can come back free of charge if
That's
they
awesome.
do relapse.
Mhm.
And
It
I
gives
call it
them.
the arm wrestling match. So the
Mhm.
hopeful message is so many people get well. If so many people didn't get well, I wouldn't be doing it for
Sure.
35 years.
Sure.
It would be too
It's not a
depressing.
hopeless
No,
disease. It's not a
not at
hopeless
all.
situation.
It
There.
is the one disease you have to convince people they have most of the time. But the fun part is to see them transform their lives in ways they never thought were possible. Because once you get on that trajectory of making really wholesome, good decisions for yourself, the
Mhm.
world's your oyster.
Sure.
And
Absolutely.
that's what's fun about the work we do. And we get to do it with you.
That's
And I
great.
know how much you all do for your patients and your amazing results. And that's why it's so fun to collaborate,
Yeah.
because then we can hand them back off to you and know that they're in incredible
Yeah.
hands and they have
As long
good
as they
guardrails.
as long as they agree to do the aftercare
Right.
or the continuing care, we like to call it, because it is not necessarily after, because sometimes they think they don't have to do as much, but
Right.
continuation of it in a real world.
And that's when it gets harder,
Yes,
because that's
exactly.
when your cell phone comes back on. That's when all the stressors kind of crawl back into
It's
your
the
life.
reality of
And
life.
yeah, in closing, you have to look at it like any other illness, right? And so if you went to ICU and you had heart disease or you had emphysema, are you going to light up that cigarette when you leave, when
Yeah.
you have the oxygen take? You do see people doing that.
Yeah.
That is a choice. And addiction it's hard.
Mhm.
It's not easy, but it does get easier the longer you do it. And so if you look at it like any other illness and the doctor says, okay, you need to go to, physical therapy afterwards, or you need to do this, and you don't do it, then you're not going to stay in remission.
Right.
And
Right.
I consider it a remission based illness.
Sure. Absolutely. Well, thank you, Denise. It was very, very,
Oh.
and I'm so glad we were able to do this in person because you are here from Malibu in Florida and visiting many people here. And to do this in person rather than over Zoom makes so much more to me. And now we get to have dinner together.
Yes.
Thank you so
Oh,
much.
thank you so much. This was so fun.
Thank you for joining the conversation today. If you are seeking help for yourself or a loved one, please reach out to our Feinberg Consulting team at 248-538-5425. That's 248-538-5425, and check out our website at feinbergcare.com. I'm grateful for our guests and all who have joined us today. Make sure you follow us on Apple, Spotify, or anywhere you listen to podcasts.